Hello, and welcome back to the Urology Care Podcast, the official podcast of the Urology Care Foundation. The goal of this podcast is to help patients and caregivers gain a better understanding about the health of Latino men. Our guest is Dr. Humberto Villarreal, an assistant clinical professor of surgery at the City of Hope Cancer Center in Southern California. Dr. Humberto Villarreal, thank you so much for joining us on today's episode of the Urology Care Podcast.
Thank you for having me today.
Can you start by telling us about yourself and a little more about your work?
Certainly. Well, as you said, my name is Humberto Villarreal, and I am an assistant clinical professor of surgery at the City of Hope Cancer Center in Southern California. My clinical interests are specifically related to reconstructive urology and cancer survivorship care. And I am also a director of men's health for the City of Hope system. And I'm just happy to be involved here in this great initiative in promoting Latino men's health.
Great. Thank you so much. So how do you hope others may benefit from listening to our talk about the health of Latino men?
I think the Urology Care Foundation always promotes the general well-being and health of all of our patient populations. It is very important that all people get great health care. However, I think Latino men are at higher risk for certain health issues. And oftentimes these come from lack of awareness or lack of confidence seeking medical care. So I think by putting this information out there and promoting awareness, I think Latino men may find comfort in learning how to advocate for their own health and to take some of these suggestions to heart in promoting healthier lifestyles.
Wonderful. So when should Latino men see a doctor?
I think a lot of it depends on age. So as we age, we can amass more medical concerns or medical problems. I compare it to driving a car. You have increased mileage, you have more wear and tear. So as we age, we probably want to engage in routine health maintenance more frequently. But certainly annual checkups are important because they can help us identify a number of conditions early on that could significantly impact our health later on as men age. Some of these conditions that we see as urologists are most notably prostate cancer, erectile dysfunction, and some issues with urinary function.
And could you go into some more detail about which specific checkups and screenings Latino men should consider, why they should be considered, and when they are recommended?
Certainly. So as I alluded to earlier, a lot of it depends on age and just getting your foot through the door and having a physician or healthcare provider that you can identify as your point of contact when the unfortunate health concern arises is important. So just having at least an initial screening assessment, which would include a basic physical exam. More often, this is to promote preventative health maintenance in most men. As we age, it's typically on an annual basis that we want to check in with our physician providers to just make sure we check all the boxes and cross all the T's. And sometimes that can lead to additional evaluations that include laboratory studies or imaging that are focused at specific concerning conditions or findings. Being aware and on top of your health doesn't stop when you're in the doctor's office. A lot of it, you get kind of a plan of action as to how to maintain and deal with your health in the future, whether that's picking up a prescription or adhering to certain lifestyle modifications. You also have to remain vigilant in follow-up of these conditions at home. For young men, this may be as simple as doing a testicular self-exam. And then a lot of this will be related to a confirmatory examination with routine medical exam, which is usually done annually. Most medical encounters nowadays have some sort of basic vital signs to include blood pressure. So if there is a concern about elevated blood pressure during that health evaluation, then it's probably a good idea to keep track of it. Not everybody has a blood pressure machine at home, but we all go to grocery stores and pharmacies, and they have these blood pressure machines available if you need to keep track of the blood pressure a little bit more closely. Some of that will depend on whether there's been an action plan to start actual blood pressure medication. Many times it's not often medicated, and then the recommendation is to undertake some sort of lifestyle modification, like changing the diet, restricting dietary sodium, etc. Then there are some more kind of advanced, kind of in-depth testing that is done as a result of shared decision-making with your primary care physician. This may include cholesterol screenings, especially if there's a strong family history of either elevated cholesterol or early cardiac disease. Usually beyond the initial screening, these can be repeated either annually if somebody is particularly high risk, or every 5 years if somebody is of standard risk for cholesterol disorder. The American diet's a particularly tricky one because it's full of fats that are not necessarily good for us. And when somebody identifies as concerning for elevated cholesterol, we want to keep the cholesterol at an acceptable range. Generally, the preferred cholesterol range is less than 200, and that's milligrams per deciliter. It's also worth noting that the total cholesterol level can also be broken down into the different cholesterol proteins and components that should also be monitored closely, to include the LDL, or low density lipoprotein, which we want to keep less than 100 milligrams per deciliter, and triglycerides, which we aim to keep at less than 150 milligrams per deciliter.
Thank you for that information. So just to recap, physical exams, testicular exams, and blood pressure checkups are recommended annually, while cholesterol checkups are recommended every 5 years or as directed by a doctor. Now, the Urology Care Foundation talks a lot about prostate cancer. I've heard that men should consider talking to their doctor about whether prostate cancer screening is right for them as early as age 55 for men who are at average risk, and as early as 40 to 45 for men who are at higher risk, such as men who have a relative with prostate cancer, like a father, brother, uncle, or son. Can you talk a little more about prostate cancer screenings?
As men get later in life, the recommended screening ages for prostate cancer screening are for men ages 55 through 69, and that's based on the American Urologic Association guidelines. This is kind of the bare minimum in terms of prostate cancer screening. And what it entails is not only a PSA, the blood test that we use to check for prostate cancer, but also a physical examination confirming the findings on the PSA screening. The physical examination is a very important part that should not be omitted, because not only can it detect prostate cancer, but it could detect some other conditions, to include benign prostatic enlargement.
Great, thank you. And lastly, can you touch on A1C test screening for high blood sugar levels?
Certainly. So the A1C is probably one of the most common basic labs that I order as a urologist. Not everybody that sees a primary care physician gets screened for diabetes, and men will come to us kind of in a roundabout way seeking evaluation for, let's say, urinary frequency and urgency, or for worsening quality of erections. To me, as I dig deeper into the clinical scenario and really query the patient on their diet and how often they see a primary care physician, this often raises my level of suspicion for perhaps undiagnosed diabetes or prediabetes. And the A1C test is a really useful test, especially if you have a family history of diabetes or are overweight, or you manifest with some of these symptoms that I talk about, in helping identify who is perhaps pre-diabetic or who is floridly diabetic. Prediabetes is generally seen in patients with hemoglobin A1C of greater than 5.7%. And that's in the 5.7 to 6.4% range, you're considered pre-diabetic. Whereas if you have diabetes, you will typically see a hemoglobin A1C of greater than 6.5 or a lot higher than that.
Great. Thank you so much for that overview of all the screenings and tests to consider. So what else should Latino men keep on their health checklist?
We're very much aware of the basic things, that we get checked when we see the doctor. We touched on labs, but we also want to, remember the blood pressure. The healthy normal blood pressure range is generally 120 over 80. Sometimes if you have other medical conditions, your blood pressure goals may actually be a lot more restrictive to prevent some of those other medical conditions from progressing. So you want to kind of individualize a plan with your doctor. And this is important in Latino men because more than 50% of US Latino men have high blood pressure. And this can lead to often irreversible end organ damage to the heart, to the quality of erections, to the kidneys. So it's very important to keep this number in mind and in check. Additionally, the other thing that gets screened when we go see a healthcare provider is our weight. And unfortunately, about 80% of US Latino men are considered overweight or obese. We look at total weight in general, but we also talk about body mass index or BMI. And the normal BMI range for Latino men is between 18.5 and 24.9. So anything greater than that is considered overweight or obese at much higher BMI levels. Sleep is something that we often neglect for the sake of continuing to be productive or trying to squeeze the most out of each of our days. Maybe we stay up into late night watching TV or Netflix, but we really want to aim to get at least between 7 to 9 hours of sleep a night. And we want that to be good quality sleep. So we want to really dissect the sleep hygiene habits. It's just not going to sleep, but what kind of sleep you're undertaking. Do you play with your phone right until you fall asleep? Is that promoting good quality sleep? Do you wake up frequently at night? Sometimes patients come to us with urologic conditions because of the way that they disrupt their sleep. So it's actually very lifestyle limiting to have interrupted sleep.
Okay, and then can you touch on erectile dysfunction and what Latino men should know about that?
Yes. So this is the one key condition that all men, not just Latino men, fear, and that's loss of their sexual function and performance. And it's often what gets men through the door at our doctor's office, right? They don't come to see us unless they're starting to notice a problem. And it may not just be them noticing a problem. They may have been politely encouraged by their partner to seek an evaluation because they've noted a difficulty with performance, whether that's decreased quality of erections that would help lead to fulfilling intercourse, or complete and total absence, which can be a warning that there's a much more serious problem to consider. But about 30 million men in the US have erectile dysfunction. This is, of course, of varying degrees. And erectile dysfunction is influenced by many of these conditions that I touched on earlier, to include diabetes, the diet, and smoking as well.
Great. Thank you so much. Those were all really great points to keep in mind. With your experience as a Spanish-speaking urologist, do you have any final thoughts or insight on what Latino men should know to live a healthy life?
I think Latino men have to accept that we are vulnerable. It's not often considered a favorable characteristic. Latino men traditionally have been guilty of machismo and being stoic, but being vulnerable is important because we often need help. We may need help from our family members in helping right the course. If we have a health problem and we need to show vulnerability when we talk to physicians, otherwise we don't really accept that there's a problem that needs to be addressed. So being vulnerable is okay. It's important for Latino men to know that the help is out there, and we as your healthcare providers are here to listen to their problems and to point them in the right direction. It's a journey. It's not just an annual check-in and you don't come back. Sometimes a visit may uncover a problem that you may need to take a medication, or you may need to change the course of your life. It is important to listen to the warning signs that are out there, much like when you're driving the car and the check engine light comes on. So just be in tune to your body, and if something doesn't feel quite right, there is help out there. You can make an appointment to see your primary care physician. If there's a primarily urologic problem, there are urologists out there that can see and treat you.
Great. And can you touch on prostate cancer and what Latino men should keep in mind in terms of prostate cancer and the number of Latino men that are affected by that?
Sometimes screening may have to come earlier if you have a strong family history, to include first-degree relatives with a history of prostate cancer. But annually, about 15,000 Latino men will be told that they have prostate cancer. It's not a condition that should be forgotten about, and it goes along with some of the other cancers that Latino men are at risk for, to include colorectal cancer and lung cancer. It's worth noting that a lot of the recommendations that I discussed, they're the bare minimum of what's out there in terms of preventative health and health maintenance for men. And we should keep in mind that every man is unique, and they need to seek out care initially, talk to a doctor about the numbers and the screenings that are right for them, and engage in shared decision making, which is a conversation. Medicine has changed. It's no longer tell me what to do, doc. It's a discussion about values and priorities and what the latest and greatest guidelines are out there to tackle disease early before it becomes a problem.
Dr. Villarreal, thank you so much for joining us on today's episode of the Urology Care Podcast.
Thank you so much for having me.
This podcast has been brought to you by the Urology Care Foundation, powered by trusted experts of the American Urological Association. For more information on today's topic and for all things urology health, visit urologyhealth.org. That's urologyhealth.org. Funding and support for this podcast has been provided by Pfizer Oncology.